a new report is released assessing the state of the country's emergency care system. The HHS Secretary does not take up the Senate Help Committee's invite to testify. And the House of Representatives unlocks the next step in budget reconciliation by passing the Senate-approved budget resolution for the week of April 14th, 2025. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
There's a lot of work ahead of us, and we're really excited about that. In November, the American people delivered unified government to the Republican Party. They returned President Donald J. Trump to the White House. They gave us control of the House and the Senate, and we are
kicking off this week's episode with news from Capitol Hill, where the House of Representatives agreed to the fiscal year 2025 concurrent budget resolution as amended by the Senate on Thursday by a vote of 216 to 214. The vote allows the budget reconciliation process to proceed. Congressional Republicans must now begin drafting a reconciliation package to advance President Donald Trump's domestic policy agenda, including tax cuts, energy policy, and border security, while trimming the budget deficit by at least $1.5 trillion. The budget blueprint charges the House Energy and Commerce Committee with finding $880 billion in savings over the next decade, which is expected to necessitate cuts to the Medicaid program. Lawmakers have now returned to their districts for a 2-week congressional recess. Both the Senate and the House are scheduled to reconvene on April 28th. During the district work period, House Democrats have planned a series of national events in opposition to the GOP budget bill, including a Medicaid Matters Day of Action on April 7th. The House Budget Committee Chairman Jody Arrington, a Republican from Texas, has reestablished the panel's Health Care Task Force and appointed Representative Blake Moore, a Republican from Utah, as the chair. The task force was previously led by Representative Michael Burgess, a Republican from Texas. This Congress, the task force plans to focus on the budgetary effects of chronic disease and opportunities to make America healthy again. Members of the task force include Representatives Mike Carey, a Republican from Ohio, Buddy Carter, a Republican from Georgia, Glenn Grothman, a Republican from Wisconsin, Aaron Hochin, a Republican from Indiana, Jay Obernolte, a Republican from California, Chip Roy, a Republican from Texas, and Lloyd Smucker, a Republican from Pennsylvania.
First, a couple more of commit-type questions. If you are confirmed, do you commit that you will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs?
Yes.
And do you commit that you will not impose new grant conditions outside of congressional direction for state, local, or global entities that in any way limits, restricts, or rescinds access to vaccines or vaccine promotion programs?
Yes.
And then
U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. did not appear before the Senate Health, Education, Labor, and Pensions, or HELP Committee, last week to testify about the department's proposed reorganization and reductions in force. HELP Committee Chair Bill Cassidy, a Republican physician from Louisiana who you just heard, and Ranking Member Bernie Sanders, an independent from Vermont who caucuses with Senate Democrats, had requested his attendance at a hearing set for April 10th. Spokespersons for HHS have declined to comment on whether the Secretary has a date set to appear before the committee. During his confirmation process, Kennedy committed to coming before the HELP Committee on a quarterly basis upon request from the chair. He is not expected to appear before the committee until after the Senate returns from recess at the end of April.
So documents for the record for the full committee markup, the documents are as on this list. Without objection, so order be entered into the record. And without objection, staff is authorized to make technical conforming changes to the legislation approved by the committee today. So ordered, and without objection, the committee stands adjourned.
The House Energy and Commerce Committee, whose chair Representative Brett Guthrie you just heard, convened a markup of 26 bills last week, including 6 bipartisan healthcare measures. During the markup, committee Democrats offered an amendment to take up and pass the end-of-year legislative package, including a partial Medicare physician fix and 2-year extension of telehealth flexibilities that was removed from the December 2024 continuing resolution. The amendment failed on a party line vote. The panel did not have time to consider a number of health bills due to scheduling conflicts, and plans to reschedule consideration of the following bills: the Support for Patients and Communities Reauthorization Act, the Charlotte Woodward Organ Transplant Discrimination Prevention Act, the Women in Lung Cancer Research and Preventive Services Act, the reauthorization of the Stop, Observe, Ask, and Respond to Health and Wellness Training Program, the Chandra Isinga Human Cell and Tissue Products Safety Act, and the Seniors Access to Critical Medications Act. More news today, where the National Security Commission on Emerging Biotechnology released its congressionally mandated final report last week. The report's recommendations are centered on the following pillars: prioritizing biotechnology at the national level, mobilizing the private sector to get U.S. products to scale, maximizing the benefits of biotechnology in defense, out-innovating strategic competitors, building the biotechnology workforce of the future, and mobilizing the collective strengths of allies and partners. The 11-member bipartisan commission, led by Senator Todd Young, a Republican from Indiana, was mandated as part of the 2022 Defense Authorization Bill. Senator Young said he is already working with the leadership of the Senate Armed Services Committee to include provisions from the report in the fiscal year 2026 National Defense Authorization Act. Winding down today, where Senate Help Committee Chair Bill Cassidy, a Republican physician from Louisiana, has sent a letter to Treasury Secretary Scott Bessent expressing concerns about the potential sale of 23andMe's genetic database of over 15 million customers. 23andMe filed for bankruptcy last month and announced that it intends to sell all of its assets to pay off debts. Senator Cassidy urges the administration to use its authority through the Committee on Foreign Investment to prevent foreign adversaries from buying the database. Cassidy wrote, quote, "Safeguarding sensitive consumer data is a top goal to protect our national security." He went on to say Chinese companies have already taken steps to collect genetic data across the world that could be used for adverse purposes. These adversaries may similarly seek to acquire 23andMe's database and potentially use it against Americans. Unquote.
We are following some breaking news this afternoon from Delaware County. Crozier Health has announced that Delaware County Memorial Hospital in Drexel Hill will now be permanently closing its emergency department. The company says the Drexel Hill Hospital will
Final
begin
news
serving
today, where the
as
RAND
emergency
Corporation
care
released a new report entitled Strategies for Sustaining Emergency Care in the United States. The report assesses the current value of emergency care, evaluates challenges to sustaining emergency care, measures trends in emergency care payment, and identifies alternate funding strategies for emergency care. The authors assert that while emergency departments offer many types of value to different stakeholders across the country, the stresses that these departments have faced over the past decade, including the opioid and gun violence epidemics, COVID-19 pandemic, increases in patient acuity and complexity, and declines in payment, put the viability of emergency care at risk. The report includes the following recommendations. 1. Stakeholders should advocate funding for the Emergency Medical Treatment and Labor Act. 2. Local governments and other stakeholders should pursue policies to allocate city and local funds to emergency department care and related activities that confer value to the broader community. 3. Stakeholders should develop uninsured and underinsured patient compensation benchmarks so that emergency departments are compensated commensurate with the level of indigent care they provide. 4. healthcare organizations and legislatures should invest in expanding primary care capacity and develop and implement strategies to address emergency department crowding. 5. Legislatures should institute a state of federal laws that protect healthcare workers by increasing the legal consequences for violence against healthcare workers. 6. Stakeholders should advocate for Medicaid expansion in states that have not adopted it yet and should advocate Medicaid parity with Medicare. And 7. Legislatures should require insurance entities to collect deductibles and copays from their enrollees and should implement a legislative fix to the No Surprises Act flaws so that payers must pay in full any independent dispute resolution judgments to the prevailing physicians within a present time frame. We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. The first and only event currently on the calendar will occur on Wednesday, April 30th at 10:30 a.m., when the Senate Appropriations Committee holds a hearing titled Biomedical Research, Keeping America's Edge in Innovation. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.